News 8.
Doctors have mentioned how the Johnson & Johnson vaccine technology differs from that of Pfizer and Moderna. It's the same technology used in the AstraZeneca vaccine, where there was also a small number of cases of blood clots reported.
Erica DeCoste spoke to a local pharmaceutical professor to help explain the differences here.
Dr. Emil Sapinoro is a pharmaceutical professor in the Wegman School of Pharmacy at St. John Fisher. With recent news of some severe but rare blood clots in women who took the Johnson & Johnson vaccine, he and other experts are pointing out similarities with AstraZeneca, another vaccine suspended for similar reasons. Dr. Sapinoro says no conclusions are drawn yet, just observations while data is examined more closely. But the two vaccines use the same technology. It's different than that of Pfizer and Moderna.
The Pfizer and Moderna vaccines, their main vaccine component is mRNA. And mRNA stands for messenger RNA, and it is something that our cells already produce naturally, and it is instructions for how to make a protein.
It educates our cells on how to detect a COVID protein without actually introducing it in the body. With Johnson & Johnson and AstraZeneca, a viral vector platform is used called Adenovirus. It's the same method of delivering instructions for our body to make antibodies, but it's using another tool.
It's a harmless cold virus that many of us probably get every year. And we're just using that as a delivery system to get the instructions for the spike protein into our cells.
Both have the same goal, just doing it differently. Dr. David Topham is a professor at University of Rochester Medical Center. He says there could be something about the adenovirus that results in blood clots, but
the data is not strong yet. What I think will happen is that they will take a very close look at those subjects that had those adverse reactions and do a number of tests to find out, genetic tests, blood tests, to find out if there's some underlying cause or risk factor that we weren't aware of before.
In the meantime, while we wait for answers, both Dr. Topham and Dr. Sapinoro say it's all about weighing risk factors, but the optics do matter, and we need to be able to get to the bottom of any severe side effects first. Reporting, Erica DeCoste, News 8.